you have anything to say about that?
No,
Yeah, being that we're not pediatric gastroenterologists, that is a difficult question. However, there are resources here in the community that I'm sure can be reached through the doctor referral office here at Boca Community to get someone who can give more exact answers to that question. Here's one that is actually quite interesting, and I think I'm going to direct this towards Vito. It says, "Sir," that means you, Vito. "I've been diagnosed as having Barrett's esophagus. I've been prescribed Prilosec and Prevacid, and due to severe allergic hives reaction, I'm now taking Protonix at a dose of 40 milligrams a day. All of these drugs have been prescribed by the manufacturer for a limited period of time, usually 8 to 16 weeks. I was told I need to take the medications for the rest of my life. What do I do in that case? P.S. I also take some dicyclamine, which is the chemical name for a common drug called Bentyl, in case you all want to know what that is. It's an antispasmodic, 3 times a day before meals. I've never had chest pain or the so-called heartburn associated with my reflux. I've been tested and treated for H. pylori. Could this be a major causative factor for Barrett's esophagus?"
What do you want me to answer first?
Well, I guess the first question here is that in the manufacturer's input, and we've all seen these from the pharmacy, the package inserts, they say only take these for 8 to 16 weeks.
I will stress again, proton pump inhibitor medications are safe for long-term use. The restrictions on proton pump inhibitor medication in this country that were put forth by the FDA were generally put forth years ago when Prilosec was the first on the market. It's FDA does this thing. When a new drug is on the market, they limit its use because they're afraid of what can happen with it. By the time even Prilosec came on the market in this country, it had been available in Europe for what, 5 or 10 years?
Prilosec was about 10 years before.
About 10 years. Here. And a lot of what we've gained as far as long-term information has been on European studies. It's a safe medication. It can be used forever. I have no reservation about that in my practice. There was one study I read that looked at the incidence of certain tumors, because that was the biggest concern with Prilosec in the stomach, and compared that to the incidence of tumors in patients who were on ranitidine or Zantac, and there was no difference. There was an article that came out in the New England Journal of Medicine approximately 6 or 7 years ago, which was a really bad article. I can't believe they published it, looking at cancer risk with Prilosec, with proton pump inhibitor therapy. And they didn't stratify anything. They didn't separate patients. It was very poor stratification of patients. They didn't control for such things as the presence of Helicobacter. Now, the presence of Helicobacter, the bacteria, for long periods of time, probably plays more a role in cancer than does the proton pump inhibitor therapy. So you have to be able to control for these factors when you really put literature down and really, these things hit the news and, hit it early. And if it's not a good piece of literature, it's not a good study, you can get a very skewed opinion. I can tell you from my experience and the world literature right now, these are safe to be used for long term. The question is, what is long term? If you're very young and you're healthy and you're looking forward another, 50 or 60 years, and with the cost of these medications and everything else, you got to value that. Well, what am I going to do? Am I going to stay on this medication forever? Reflux disease doesn't just go away. Barrett's, literature I reviewed as far as Barrett's and Helicobacter, they're separate entities. Barrett's can occur whether you have Helicobacter or don't have Helicobacter. Helicobacter pylori clearly is a major player for ulcer disease. There is some indirect influence on reflux, but you cannot really consider it an agent that causes reflux disease. There was something else with Barrett's that they wanted.
No, I think that's basically it. He asked about having to take it for the rest of his life and about the effects of H. pylori.
There's one of the point I think is important. I think this is a sort of a question that was waiting to be asked in this question. The real issue with Barrett's is if you have Barrett's and you aggressively treat reflux disease. Now, that aggressive treatment could mean a lot of medication or it could mean anti-reflux surgery. Can you prevent the progression to dysplasia, which is part of the progression toward cancer? That's a very intriguing question. I actually wrote an article on this about 10 or 11 years ago, maybe 12 years ago, where I reviewed the literature. So it was basically not an original article, it was a literature search and review that suggested that mild degrees of dysplasia may actually be reversible. Mild degrees. Once you've achieved more advanced degrees of dysplasia, because dysplasia is measured as mild, moderate, and severe. Once you've reached severe dysplasia, you might as well consider that as impending cancer. And that's not reversible. And that's our current feeling right now.
Okay. This same gentleman had an addendum to their question.